I'm Dr. Doug Josephson. Welcome to Roswell Pediatrics Center. This video is an opportunity for you to learn a little bit about our practice, as well as to learn a little bit about what to expect after you deliver your baby. Roswell Pediatrics Center started in 1978 by Dr. Fred Flax. Since then, we have grown to include 12 pediatricians and 6 nurse practitioners. During that time, we've only had one doctor leave, and that was when Dr. Flax retired a few years ago. We have 3 office locations. Our main office is our Haynesbridge location in Alpharetta. We have another Alpharetta location by the silos off Crabapple Road, and we have an office in Cumming. Our office hours are 8:30 to 5, Monday to Friday, and our Haynesbridge office is also open on Saturdays from 8 to 11:30. We utilize a lot of technology in our offices. We have been on an electronic medical record system since 2001. The advantage of this is that your child's records are immediately available at all 3 of our offices. That gives you the flexibility to go to any of our 3 offices and to find appointments that are most convenient for you. We also have a website, roswellpediatrics.com, on which you will find a lot of important information about our practice. We also have the capability to utilize a telemedicine service to see your child if needed. We also use Freesia for our check-in services. The advantage for this is that you can do all your paperwork and your check-ins prior to coming to our office. We also have the ability to allow self-scheduling of appointments for both well checkups and sick visits online. This can be found through our website. Again, our website is roswellpediatrics.com. When you arrive at the hospital to deliver your child, please let them know that Roswell Pediatrics Center will be your child's pediatrician. Right after birth, your child will receive eye drops to prevent a severe eye infection, as well as a vitamin K shot that will prevent severe bleeding in the first 2 months of life. The neonatologist at the hospital will see your child over the course of that first day, and they'll come talk to you about how things are going. Once your child turns 24 hours old, the hospital will obtain a few drops of blood from your child and send that off to the state lab for a metabolic screen. This screen tests for 35 disorders that are rare, but if we find out early on about these disorders, then there are things that we can do to prevent severe complications. Also, your child at 24 hours will have an oxygen test done, which is just a pulse oximeter light that goes on either their finger or their toe, and this is a screening test for congenital heart disease. On the second day, the neonatologist or nurse practitioner at the hospital will check your baby out again and talk to you about what to watch for when you guys go home. Either the first day or prior to discharge, your child will receive the first vaccine, the hepatitis B vaccine. If for some reason they do not receive it at the hospital, we will discuss that and provide that in the office. Also, before leaving the hospital, your child will have a hearing screen. Even if your child does not pass this hearing test, it does not mean your child has a hearing problem. Frequently, babies do have a lot of fluid or debris in their ears that can prevent them from passing this test. They will repeat that at least once if your child does not pass it again in the hospital. If your child still does not pass it, we will arrange for your child to see an audiologist in the first couple weeks of life. As far as the metabolic screen, you'll get the results within the first 1 to 2 months after your child's born. The way that works is if there's an abnormality, the lab will either call you guys or call us, and we will then contact each other to discuss what to do. Or if it's normal, the lab will eventually send our office a pile of papers of all our normal newborn screens. As we work through those, we will notify you that your child passed that test. If your child has an abnormal newborn screen, it does not mean that your child has a problem. It just means that we need to do some additional testing. At that point, we'll discuss what that testing is, But in the majority of the cases, when that test is abnormal, we eventually find that kids do not have that disorder. Once you leave the hospital, we'll plan to see you guys in the office within about 2 to 3 days. As soon as you know when you're going to leave the hospital, please give the office a call so we can schedule that first appointment. Once you're ready to bring your child into our office for their first visit, you will receive an email from us with information on how to check your child in. This is through our Freesia system, and we strongly recommend that you complete all the information that is asked prior to coming to the office. This will save you a lot of time once you come to the office. Once you arrive at the office, you will meet our smiling front office staff who will ask for your driver's license or photo ID, as well as discuss any payment if necessary. At that point, one of our medical assistants will bring you back to the room and weigh your child, ask you questions that will be helpful for the provider, after which the provider will come in and they will examine your child and answer your questions. At this first visit, we recognize that your child will lose weight in the first few days of life, and your baby may lose up to about 10% of their weight in the first week of life. Usually by 2 weeks, babies have gained that weight back. In addition, we'll go over some developmental expectations. We'll review the paperwork from the hospital, and we'll come up with a plan on what you would expect and when all your next visits will be. Expect in the first year that there are a lot of visits. We do well child checkups according to the American Academy of Pediatrics recommendations, and this means that after that first visit, your child will have a 2-week checkup, 2-month checkup, 4-month checkup, 6-month checkup, 9-month checkup, 12-month checkup. So as you can see, there are a lot of checkups that first year. We also recommend starting the big series of vaccines at 2 months. If you look online at roswellpediatrics.com to see the vaccine schedule, you will note that there are also a lot of vaccines that are given in that first year of life. We are strong believers in vaccines. Vaccines have significantly reduced disease burden in this country and are a very safe and effective way to keep your child healthy. We do care for a lot of fragile kids in our practice, so if you feel that vaccines are not for you or your family, we will discuss this at both the 2-week checkup and 2-month checkup. However, if you feel that you do not want to vaccinate your child, we feel that it may put other patients in our practice at risk who may medically not be able to get vaccines. So we will encourage you to look for another pediatrician. However, we will work with you on getting your vaccines scheduled and into your child, and these are things that we can discuss at your child's checkups. At all the checkups, we will weigh and measure your child, and we will provide growth curves to show you how your child is growing. We will discuss any developmental concerns. We will also discuss safety, nutrition, and answer any other questions that you may have. So some other questions that we're frequently asked about. 1, should I circumcise my child? When you're at the hospital, you will be asked this question if you have a boy. And the way I answer this is, it's probably easiest to do whatever dad is. So if dad's circumcised, I probably encourage you to circumcise your son. If dad's uncircumcised, then I think it's reasonable not to circumcise your son. Circumcision may provide some benefits. However, the benefits are very minimal. We've learned that baby boys in the first year of life who are circumcised do have a lower rate of urinary tract infections. We also know that adults, males who are circumcised, have a slightly lower rate of penile cancers. Now this risk goes from about 2 in a million down to 1 in a million, so it's not that big of a difference. And we also know that circumcised males have a lower rate of acquiring HIV disease. Again, I don't think these are reasons to necessarily circumcise your child, but it is an option. In this area, the OBs do the circumcision, and they will discuss with you your options at the hospital. We will discuss when you come in for that first visit ongoing care for your child's circumcision if you decide to do that. Another question is that we're asked frequently is about breastfeeding. When you're at the hospital after you've delivered your baby, if you're going to breastfeed, which we encourage everybody to strongly consider starting, you need to start breastfeeding right away. If you wait till about 2 weeks of life and come in and say, hey, I want to try breastfeeding, it's going to be really hard for your body to make breast milk. Recognize that for your first child, it can take 5 days for your body to start making breast milk. So breastfeeding is very frustrating at first, but it can be both very beneficial to your child and very rewarding to you as a parent. So we definitely encourage you to start at the hospital. I also encourage that you meet with one lactationist at the hospital. The lactationists are a great specialist that will really help teach you all the tricks to breastfeeding, because it's not as natural as everybody thinks. And once you leave the hospital, the lactationists are a great resource that you can call if there are ongoing breastfeeding difficulties. A third question is about insurance. One thing people don't realize is just because you're in the hospital delivering your baby, that the insurance company knows to put your baby on the insurance plan. So after your child's born, you need to, as soon as possible, contact your human resource department, your insurance agent, your employer, or whoever you need to get your child added to the insurance. As we talked about before, there are a lot of checkups and a lot of visits in that first year of life that can be very expensive. So it's very important that you get your child on your insurance. If you wait more than a month, either 28 to 30 days after your child's born, you're not going to be able to add your child to the insurance until the next open enrollment. The fourth thing people frequently ask are, what kind of labs can we do in the office? Well, we do have a lab in each one of our offices. We can do multiple procedures, as we are a drawing site for LabCorp, so if we do need to send any blood work out for your child, we can obtain that in the office and send it to the lab. In addition, we're able to obtain bilirubin levels in our office, so as your child goes home from the newborn hospital, if they're concerned about jaundice, as when your baby turns yellow, we can recheck that level in our offices. We also do strep tests, we do throat cultures to back that up, we can do urine tests, we have the ability to measure lung function in our older kids called spirometry, we have hearing machines, we have computerized vision tests starting at 6 months that we're able to do. We do hemoglobins, which is a way to measure a child's iron level. So we're able to do a number of things in the office. Another question that families frequently ask is, do we have multiple entrances to our offices? And the answer is yes. Each one of our offices has a well entrance, a sick entrance, and an emergency entrance. If you're coming into the office for a well child appointment where your child is not sick, or it could be for an injury, for a checkup, please use our well entrance. If your child's coming in for a sick visit, meaning your child has a cough, fever, they're throwing up, please use our sick entrance. We do this to try to keep apart all the germs, so when you're coming in for a checkup, you're not going to be next to somebody who is sick and potentially can make you sick. We also have a third entrance, which is our emergency entrance. If you speak to one of our triage staff and our triage staff asks you to use this, it may be because your child has a rash that they think could be highly contagious, such as chickenpox. The last thing we want to do is bring chickenpox in through our main entrance and spread it to other kids. So if you're asked to meet us in the emergency entrance, it's not because we're worried that your child's really sick, it's just we want to try to limit the spread of illnesses. Our office is a big proponent of cleanliness. We have hand sanitizer throughout the office. All our providers have a sink that they use before and after they examine your child. And again, the 3 entrances help us keep the office clean. Again, my name is Dr. Doug Josephson. We look forward to seeing you in our office soon. If you have any questions, please either look at our website, www.roswellpediatrics.com, or call our office, 770-751-0800, and you can speak to one of our triage staffs with any of those questions. If they're unable to answer your question, they will send a message to either myself or one of our other providers who can give you guys a call back. Again, congratulations, and we look forward to embarking on this exciting journey with you.